You're watching the 10 o'clock news.
Well, the number of people who smoke continues to drop, but lung cancer remains a leading cause of cancer deaths here in the U.S.
That said, it can be treated, especially if it's caught early. That's why, as Fox 5's Richard Giacobbe shows us, the guidelines on who can be screened is changing, and it no longer matters when you quit smoking.
With lung cancer being the leading cause of cancer-related death in the United States, the American Cancer Society releasing new guidelines that could save millions of lives.
If you find it early, we can cure it, and that's the whole point of screening patients.
According to the ACS, lung cancer still causes more than 350 deaths each day. That number is higher than breast, prostate, and pancreatic cancers combined. The organization is now recommending annual lung cancer screenings for adults aged 50 to 80 years old who currently smoke or have smoked with at least a 20-pack year smoking history. Previously, the screenings were recommended for those aged 55 to 74 with a 30-pack year smoke history who either currently smoke or quit smoking 15 years ago.
There would be roughly 21% more lung cancer deaths prevented and about 19% more life years gained compared with the current recommendations.
Thoracic surgeons like Dr. Todd Weiser of White Plains Hospital's Center for Cancer Care applauds the new guidelines, saying the key here is no longer keeping track of when you quit smoking, because now it doesn't matter.
Data suggests that these cancers can develop in patients that have stopped longer than 15 years.
The annual low-dose CT scans are crucial in treating smokers who may develop lung cancer at a younger age and can very likely save someone's life if the cancer is caught early on, says WebMD's Dr. John White.
So earlier is always better.
With these new recommendations, 5 million more people will be eligible for lung cancer screenings in the U.S., which will give them access to resources to help kick the butts for good. At least doctors say that's the hope. The American Cancer Society says cigarette smoking accounts for around 80% of lung cancer deaths each year. Dr. Weiser, meanwhile, says only about 5% of smokers in New York State get screened each year. He hopes that number will rise with these new guidelines and more lives will be saved. We're on the Upper East Side. Richard Giacobbe, Fox 5 News.